Good morning. You're welcome to today's lectures. Today we take a look at DDT 253. Marker, please. 253. Pharmaceutical calculations. I sure Vera is okay. 253. Dosage what? Or calculation of doses. That's where we stopped yesterday. We introduced it yesterday. I mentioned dosage regimen. I think that's where I stopped, right? Yes, sir. So, have you heard of the term dosage regimen? What does it mean? What is dosage regimen? Who can tell us? Huh? Frequency and ratio. What is this one? What is dosage regimen? I think frequency and ratio. What is it? Breast Noya. You are there, but who can make it to be smooth? Who can smoothen it for us? She got it, but it's rough. Who can smoothen it for us? Okay, Fufeda. Okay, who? Someone now. Chinaya. Will be Chinaya. You have nothing to say. It's your wire. You have the idea, boss. You have the idea, boss. Who will do it for us? Nobody. Give to Oya. Tell us. What is dosage regimen?
Dosage regimen is a specific plan of blending the administration and medication, including the dosage, creation of the administration,
The
dosage.
plan, okay. No, start and begin again. What you said now.
Dosage regimen is the specific plan of blending the administration and medication.
Okay.
And it's given by the dosage, the frequency of administration.
Thank you. You have the idea, and I give to smoothing it a bit. She's smoothing it a bit, but just as she said, when you a prescription is actually, if you see a prescription is actually is actually composed of dosage regimens of different what medication. Simple. If you see a prescription, how the medications are outlined there. Each of the medications you see there, starting from the dosage form, the name, nomenclature, strength, dose, frequency of administration, and duration. That is what is called what regimen for a particular what drug. Now, a prescription may be a one regimen prescription whereby you have just only one regimen, maybe only paracetamol, for example. Now you may form a prescription. Hope you know, depending on what the physician is what treating. Maybe you just tell patient just take what paracetamol. Am I complicating? It can form a what a prescription. You just want what regimen. Am I complicating? Now you see, you may have a prescription now for a prescription for malaria treatment. Now, if you see a prescription for a malaria treatment, maybe the patient has been diagnosed maybe from the lab results to have clinical work. Of course, from the signs and symptoms, and also from the lab too, it shows that this person has what is suffering from what malaria. Am I communicating? Then the patient may, based on the physician may not give only anti-malaria, something like artemether lumefantrine. You may find out that the patient has headache. Possibly the blood level has also what gone down. Of course, the common symptoms, fever. You now see in that position, you see regimen for what? Artemether lumefantrine. Regimen for what? Paracetamol. Treating what? Fever, right? That for, of course, and headache too. That for hematinics, for blood, to boost the what blood level. Maybe the patient may also be diagnosed to have what typhoid, salmonella typhi infection, typhoid. You see regimen for what ciprofloxacin. In that same what it's a prescription, but it has different what regimens. Am I communicating? You start seeing tablet paracetamol, ciprofloxacin. You see something like this. Maybe the chief call priest call what? Is it call priest? Thank you. So you see them because of they may see, because of the how lengthy it may be, they may use a brand name. Okay, because of how lengthy. Okay, you may see something like a what example? Lonard. Good. Maybe for an adult, right? Lonard DS, right? And you start seeing something like this. BD, right? Times what? 3/7. Are we together? To treat what? To tackle plasmodium directly, right? Maybe the patient also has a salmonella typhi. To tackle salmonella typhi for typhoid, you see it's sort like ciprofloxacin. That's ciprofloxacin. Thank you. 500 milligram. BD, of course, you know that this should be 12 hourly. When you now cancel the patient, it should be what? 12 hourly. Hope you know that. Of course, when you now want to cancel it, if we start writing that thing I discussed yesterday, the whole board with the whole position paper will do what? Fill up. But they write like this. It's you now, as a pharmacist, in the pharmacy section, that will now cancel the patient on how to take it for what effectiveness. I put it together. Now, maybe for 5 days, this can run for 5 days or 7 days, depending. Maybe for 5 days, you see something like paracetamol, right? paracetamol, 1 gram. Of course, you know that now for an adult, right? TDS times what? 3 over what? 7. You see something like this is for the fever, headache, right? You see something like a cap, maybe capsule astifa, okay? Astifa, maybe to take one BD times maybe depending up to 5 over 7 depending. This regimen is a what? Regimen. This is a what? This is a prescription. Am I complete? All these things are added because of other things diagnosed. Am I communicating? Am I communicating here? Sometimes this may not be there. Sometimes, most times, in fact, the first thing that you notice is headache and what? Fever. This is always there. Most times. Am I communicating? But if the fever stops, because this and this will coincide the same duration of what? Treatments. So before you finish this is sometimes maybe the patient before they finish the anti-malaria, the fever and headache would have gone. Once the fever and headache stops, you can stop this. But if you start feeling better after 2 days, don't stop this. You must complete the what? The course. To avoid what? Am I communicating? Now, the same thing with this one. But some of you, even here, once you take it for the first 2 days, that's the end. Especially Cipro. You pack the remaining 6 tablet and do what? Throw it away. Or you tie it in nylon and put it in your bag and leave it there. Maybe after 2 months, when you come back again, you now go and start searching it again. This is guilty of this. She's laughing. Now, are we together? Yes. Now, so look at it now. But of course, when you study drug interaction, you realize that you don't take this and this together. This and this together. This, in fact, especially this and this. I think I mentioned everything, right? When we discuss factors affecting drug, we discuss these things. Of course, this you are the one to tell your what patient, not the physician. The physician has prescribed. It's when you now want to hand over the medicine to your patient. You now do what? Counsel them properly on how to. Do you want to take first? Normal, you should take this one. You can take this and this together, no problem, okay? When if you must take this, because maybe you can take this, of course, let's assume you can give like 2 hours gap between this and this, okay? 2 of them, you can give like 2 hours gap and take them. But this one should not even come close to this one at all, because it won't allow you to be what? Absorb. Am I communicating? These are things you now tell your what patient. But what you are treating here is just we are talking about what dosage what regimen. So this regimen is regimen for what is the dosage regimen for typhoid using ciprofloxacin. It can be a question. What is the dosage? What is regimen for typhoid with Cipro? It's simply what tablets should be taking what. You should be taking what? 500 milligram for an adult, anyway. 500 milligram 12 hourly for 5 to 7 days, okay? 5 to what? 7 days. Am I communicating? Do you not understand what a regimen is? Do you not understand what a regimen is? So, that it is. So, there are some examples here in our course materials. You see things like dosage regimen for using clarithromycin. You see something like 250 milligram every 12 hours for 7 days. You must include the duration of what? treatment. So now let me now dissect this now. In this dosage regimen, based on what I have here now, you see something like this. Based on what I have here now, you see something like you must include the dosage form. You must include the word dosage form. Very important. You cannot just say suppose the same. Are you talking about infusion? Are you talking about eye drop? Are you talking about ear drop? What are you talking about? Is it tablets you are talking about? So you must include the word dosage form. So this is what dosage what form must be what included. Of course, the nomenclature must be there. The what nomenclature must be there. Of course, you know the recommended nomenclature. What is it? For prescription, what is that? Generic name. Of course, you know why I use this here, because of the length, and also it's a popular brand. So if they see Lonart here, they know what it. In that situation, you can use it, no problem. Am I communicating? But you don't force your patient that it must be this. But because of length, you can now use Lonart, okay? Now, but if they have the money for it, wonderful, they'll buy it. Now, we have this one is, of course, the recommended this is what? Generic what? Name. Now, we talk about what? The strength. This is where the issue lies. The dose. This is where the issue lies. What is the difference between strength and dose? What is the difference between strength and dose? If you know it now, stand up and answer. If you know it, stand up and answer. What is the difference between strength and dose? Who knows it? You can talk now. You are just raising your hand and bringing it down. Let's judge her. Oh, yeah. Okay. Good. I like that. Who can smoothen us? Okay. Good. Now, let me use what you know on a normal. What you know, what you do on a daily basis. Because of your tummy, you have a big tummy. You eat well. You eat well. You have this thing for food. So something like someone like a superb that can eat well. Who else can eat well in this class? This one. I forgot her. Now you have you have biscuit now, right? Biscuit now. Biscuit. Let me not say biscuit. You want to take the egg. For example, now, if you go to the market, you notice that the garden eggs, they pack them, they arrange them, right? Yes. In 5s or 10s. Now, that arrangement in 5s or 10s is like strength. The person selling it now can be taken to be the manufacturer now. He has arranged, the person had arranged it in 5s. But you as a person, that if you go to market to buy it, you look at that 5s and 10s. The one that will be okay for you, one will not be okay for you, right? Yeah. Right? So that amount that will be okay for you is like the dose. The strength is how the person arrange, package it or arrange it. But the dose is the one that will be okay for you. You now look at one is not okay for you, right? You may say, madam, give me 5. Is five of those arrangement that will be okay for you, right? Now, in that case, now the dose you want does not coincide with the strength presented by the manufacturer. I'm not competing, but there are some situations whereby if you look at that one, somebody else may come and look at that only that one fives and like it and say, just give me only one. In that case, now the dose is the amount that will satisfy the person. Is concerned with the what? Strength, how it is presented. That is people mistakenly think that they are the same thing, because sometimes the dose may coincide with the what? Strength. Sometimes it may not coincide with the what? Strength. Now let me bring it now back to what? Pharmaceuticals. As an adult, I have fever and I have headache. A baby or a child of about 5 years also has headache or what? Fever. Now, if I now buy paracetamol tablets in that card, paracetamol is formulated as what? One tablet is how many milligram? 500 milligram, right? For me as an adult, the dose that will take care of at least I can take at a particular point in time based on the profile of the drug is 1 gram, which is 2 of the 500 milligram. In that case now, I need to take 2 of that tablet to be able to do what? Take care of the dose for me as an adult. But the child need to take only 1 tablet. In the child's case, the child's dose and the strength coincides. But for me as an adult, I need 2 of those strengths to be able to get 1 gram. Am I computing? So dose and strength are not the same. Chineye answered it well. She said that strength has to do with the amount, a good package presented the medicine, because it's now what? Medicine, right? Good. That is the strength it comes. The strength it comes is the amount it is presented or packaged for market, right? Good. But the dose is the same dose we defined as the amount that is required to achieve a therapeutic outcome at a particular point in time. Am I communicating now? So that amount is different from the total amount. So that's why people get confused about it. They are amounts, but the strength is how it comes. Why the dose is the amount you need to achieve a particular what? Taking care of headache is achievement. Trying to achieve a particular therapeutic outcome. What is the therapeutic outcome? That the headache stops, right? And the fever goes down, right? It's an outcome. It's a result. So the amount you need to achieve this result is the dose, while the strength is how it is what presented. So that's why I separated them. Sometimes, okay, I can, if I put stroke now, you think they're the same thing. Am I communicating? Sometimes they may coincide, but sometimes they may not coincide. Like here now, they coincide here, 2 of us, because she proposed that thing is presented as what? 500 milligram in a tablet, right? And an adult needs 500 milligram for a dose, right? So that's why it look as if they're the same thing here, but they're not exactly what? The same thing. So now, you should also include frequency of what? Of what? Administration. Very important. Frequency of administration. This is dosage from nomenclature, strength or dose as case may be, right? Frequency of what? Administration. How you take it, how many times, right? So why this is the what? Duration of what? Duration of what? No. Duration of what? Treatments. Okay. Duration of what? Treatment. So dosage regimen should contain all these things. Can you see the block from there? It should contain all these things. 1, 2, 3, 4, 5, 6. It should contain all these things. Any question? Okay, so let's continue. Of course, you know what if when you talk about formulations, compounding, you normally that's same thing, but you normally use the word compounding when you are doing what you are extemporaneous what. But for formulation, it's more of what large scale what production. Okay, although even though in some situations they use interchangeably, but when for formulation comes in our mind, to talk about large scale what, like now in manufacturing what firms, okay, where you produce in thousands and millions of what tablets or bottles or as the case may be. Now, when we did our when we did our in your first year, when we did the meaning of dosage form, right? Remember, of formulation. Remember, I told you that a particular drug can be formulated in different words, in different words, in different words, dosage forms, right? Good. And within a particular dosage form, the same formulation the same drug can be formulated in different strengths. You're aware of that, right? I think I mentioned it somewhere here. There are some drugs that, okay, example now, this fixed dose of course you know what fixed dose combination is now. This fixed dose combination, ampicillin clozaxilin, popular brand name is Ampiclos. Now you have it, okay, mainly that one comes as 500 milligram mainly, yes, but something like amoxicillin, you have amoxicillin 250 milligram. You also have amoxicillin 500 milligram. The same drug, the same dosage form, but different what strength. Am I completing? Now, a good company, if they want to formulate, will normally carry out research to know exactly the dosage forms, the strengths that is prevalence in a particular what area or country. The dose that are being prescribed more based on the patient in that particular country. Am I communicating? A good company that is serious with business, this is what they find out. Then if they find out that, they look for a way to do what? Get that strength out together. So that if your company, let's say there are if a physician work prescribe amoxicillin 250 milligram, or even, of course, have you seen amoxicillin tablet before? Have you seen amoxicillin tablet before? Tablets. Who has seen tablet before? It's not common, but there is the one that is common here is what capsule. Now let's assume now that a physicians the company knows that the physician prescribe more of the what 50 milligram now. If a company presents present it as 250 milligram, you find out that it will sell more. True of us, it will sell more. Okay, another example. There was a time, I think Emzo started. I think it's been long I left the field, marketing and all those things. They started paracetamol 1 gram. Who has seen it before? Emzo, right? Yeah. They started paracetamol 1 gram. Now, if a physician prescribe 1 gram for adults, and you in the pharmacy you have 1 gram, will you pass through the stress of telling the person take two? You simply go and get 1 gram and do what? It's a marketing. It's a marketing this thing. Am I competing? Yes, it will sell more. It's like for adults. Because if you take actually, even though I don't know the price, but if you take the price of 2 gram, sorry, 2 tablet of 500 gram, this one will be cheaper. This one will be less. Is less. The cost will be less than that of 2 tablet of what it should be. That's what it should be. That is what it should be. So you see that this one has more edge, especially for adults. Now, so that is the importance of knowing this issue of having different what strength. Not only as a solid dosage form, you also have this as liquid dosage form. You have amoxicillin. I think I gave you instances here. When I was talking about telling you that it's not good to prescribe, it's not ideal, it's not a good thing for a physician of liquid dosage form to be coming as syrup or suspension amoxicillin 5 ml TDS. It's not a good practice. In case you see it, please try to find out from the prescriber which strength he's talking about. Yes, because amoxicillin can be, you can have it as you can have it as 125 milligram per 5 ml. You can also have it as 250 milligram per 5 ml. So which strength? So 5 ml is 5 ml has no meaning. Am I complicating now? Am I complicating? So it's you now, your knowledge now in this area will now help you to know exactly what to do. If you're not careful, you may rush and go and get 250. You may have 250 milligram per 5 ml. And sometimes they may not even, the patient may even come. You don't even know who is taking the what medication. Because you've seen 5 ml and the one you have is 250 milligram per 5, and the physician doesn't even know. He may be an independent pharmacy that has no business with the hospital. So how will we now reconcile it? You go and carry what? 250 milligram and do what? And give. Maybe the physician had in mind for a child, maybe around 2 years, that should take, or a year, that should take 125 milligram per 5 ml. He just wrote 5 ml TDS. And you just see, because you want to do sell, you rush and carry 250 milligram and dispense and make your money. You didn't answer that question. Which strength is he talking about? So this is why it's important to know all these things. Are we together? We also have it as even injection. Of course, in injection form, we have it as what? Injection form, we have it as what? 250 milligram, 500 milligram powder for what? Reconstitution. Powder for what? Reconstitution. So, the point I'm making here is that the formulation may come in different dosage forms. Even within a particular dosage form, you have it in different what? Strengths. So, note that. So these are the things. These are the things that would distinguish you from others, especially those that not pass through this what training. So anyway, you should make a what difference. Let's if you want to if you are working for somebody or an organization let them know that somebody joined us. But if you are empty, how do you make that word difference? If you are empty, the only difference you make is to create nuisance there. It's normal. Am I communicating? It's normal. Like now, if I stand here now, not knowing what to teach, cover on, on now, time haga. It's not true. So if you don't know what to do, you cover asari. When I cover on several, a new suspension. So now let's look at let's go into this formulation properly and see what we can make out of it. Okay, you cannot. Is it what? Okay. Are you serious? You better what I was saying. What happened? Can you see me? Can you see me? Can you see me? All right, thank you. Okay, now I understand what happened. Let me stay here. Any question? I should write down. Good. Okay. Another point I want to make here is that, of course, I think I have mentioned this before. You have some formulation that comes as what fixed dosage, fixed what dose what combination, right? It's no longer a new term to you, right? You don't have it as solid. Even most liquid come like that anyway. Normal. Most liquid formulation comes as fixed dose because I've not seen a liquid combination where you have this drug is packaged in bottle, liquid, in the same pack, separate. Another one package in the same pack, in the same pack, separate. It's only you saw. I've seen they do like that. You saw where you mix and apply externally, right? But the one you take in, I've not seen. If you have seen, let me know. At least I know we have you salt A, you salt B, right? Before you use them, you do what? You mix before you apply, right? That's the only way we have seen they are packaged separately and put in the same. They are in this same pack, separate primary container and the same tertiary or secondary what container. True of us. Yeah. Now, apart from that, these feeders combination and the kits, you see them more in what? You see kits more in what? Solid what? Dosage forms. Are we together? Are we together? So I've shown this is an example of them, right? Where you have artemether and the what? Lumefantrine. True of us. This one is a brand name. It's a what? Brand name. It's a brand name. So inside it we have artemether and what? Lumefantrine. Some of them comes in a sachet, like 24 in a sachet. When they come in 24, each of tablet contains artemether 20 milligram and the lumefantrine 120 milligram, right? Good. But if they come like six tablets in a sachet, one of the tablet is bigger. One contains artemether 80 milligram, lumefantrine 480 milligram. So it's a fixed dose combination. It's a fixed dose combination. And also when I was discussing kits, I made mention of ulcer kits. Ulcer kit, can you remember? Ulcer kits where you have what else? No. Symmetry is not there. It's omeprazole. There's an antibiotic there. Abu, hey, what are you saying? I won't tell you. Find it out and tell me now. Browse it and tell me now. The content of Osa Kids. Tell me now. Eh? No, don't give me a second. Check it up now and tell me. They come as kits. Nabife, oh yeah, tell us. Huh? Oh yeah, tell us. Who has seen it? Omeprazole. How many milligram of omeprazole? What else? How many milligram? 1,000. How many? Is the picture there? If you see the picture, you find out that they are separate. They're not. All these are not in one. They're not in one capsule, right? They are separate. We call it a kit. A kit. Iwelonka, it's called a kit. Am I complicating? So in fact that's where we got the name Ulcer Kit. Ulcer Kit. Are we together? That's where the name came from. Ulcer Kit. Can anybody hear the call? Oh, Amazon when they are going to which company again, sir? I forgotten. No, problem. I blame be a Tata. Brad got the company, either Emzo or it's Emzo. Zolon is part of is owned by Emzo. It's their own. It's their own. You know they formed Glycolit group. It's no longer. It's now a group. So it's part of. It's their subsidiary. Either their is their sister company or so. But Zolon is more international. I think more international. Why, the company has gone far. The company has gone far. So Zolon and Emzo are just is owned by the same people. All right. So now, do you now understand fixed dose combination? Hello. Do you now understand fixed dose combination and kits? So now let's solve a question, then we'll see how far we can go, then we move on. We look at liquid formulations. Someone should come and write down this photo fast. No, come and write to you. Fast. Nasike. You never since. I can idea of fufu. I have fast. question. The question says, calculate the total number of tablets to be dispensed if a prescription requires 2 tablets of drug X 3 times a day for 7 days. How many regimen there is what? One, right? Just regimen for X, right? Who can solve this question for us? Who can solve for us? It's a simple question. I can't solve for us. Please, before solving, ensure write the regimen first before solving. Very important. Okay? Please listen to me. If I give you question that has to do with dosage calculation in theory question, please write the regimen for me first before you start solving anything. Don't jump and start doing times 2 times 3. You must write the regimen and you should write it correctly. When you are done, you can now start your what calculation. Now, okay, let's see what he did. Osnogin. Osnog 2 times 3. Please, who someone should come and write the regimen for us here, please. Someone should write it well so that we can see. Hello, there's something I want to let you know. Please, once if you listen carefully, if you write it out well, once you look at it, you don't even need to even press anything. You just the answer will just come out because it will be clear. Once you write it like this, you are good to go. By looking at it, you already know this time this, and you get the answer straight. Good. Tab X, right? II, TDS. You can simply write. This is not marketing. What's going on here? Our markers are not marking again. Why? Who has marker? Cynthia. It's not wrong. It's not wrong, but this is more conventional. Okay, I'll mark it. No problem. I'll mark it. But it's always good to once you get to 6/7, just move to 1/what. Can you do what? No. Eh? 1/4. Mba. Mba. It's clear, right? Right? Good. Let's go to the any. What is this? Hello? What is this? Okay. Good. What of this? Six weeks in a what? Per year. Yes, right? This one is what? This one is what? Are they the same? Are they the same? What of this? No more, I come fast. Mbak, Aichabo mumu. Kenko. Hey. All right, so look at this. Hello? A prescription requires 2 suppositories of drug Y daily, 2/7. How many suppositories should be supplied? 6. Bless, what's the answer? Come on, solve it fast. Come out fast. Gasike. Blessing is coming up. Stop making noise. Go there and solve it. Take. Hello, please, attention, please, please, please. No noise, please. No noise, please. Good, like that. Good, continue. Good. Please, let's listen to her, please. So somebody is solving something on the board.
Okay, sir.
Find the regimen first. There you go. Oh yeah. Clear. Oh yeah. Go. Fast, fast. Call that off. Oh yeah, go. Huh? You said what? Go there and solve for us. Fast. Of a question, I will one day at 20 minutes because This simple question. Hope you know that if let's assume this is a theory question you solve. Hope you know that you may not get up to 2. Yeah, hope you know. Are you aware? To know it now that you may not get up to 2. Just know it and be happy. Where's the okay? So a prescription requires 2 suppositories of drug Y daily for 3 days. How many suppositories should be supplied? How many should what be supplied? Two, right? Right? Right. So here is what? 2 times 1, right? 2 times 3, 6. So 6 suppository for what? For the 3 days, right? So 3 suppositories should be what? 6 suppositories should be what? Supplied. 6 suppositories should be what? Supplied. Now let's look at oral question. Good, ask. OD, AD, daily. It's okay. It's not bad. It's okay. It's not bad. Yeah. You know some positions. This in case while you are doing this, in case if you see it in a prescription, some physician may want to use these things. So you know what it means. Where some physicians don't have time for all those, they just write daily for you. Okay? You don't know where you see yourself tomorrow. Am I communicating here? Yeah. Right what? SID. Wow. Show me the table. Let me see. All right. Let's look at oral liquid formulations. When you have oral liquid formulations, I think I have explained this before. Okay, I have explained this what before. That if you want to administer dose less than 5 ml, what are you going to use? What do you use? Good. So 5 ml and above, you start using what? Teaspoon, right? From teaspoon, you come up to what? Tablespoon, desert spoon. Then from the desert spoon to what? Tablespoon. Have you seen it? Amoya, come out fast. Come fast.
Yes, I
Good. I like that. Download this. Okay. Please, I want to. Please try. I want you to revise or go through this medical Latin abbreviations used in prescription. Please go through them again. Okay. Go through them again, especially those that have to do with frequency of prescription. Those that have to do with frequency of what? Administration. Please go through them. Am I communicating? It will help you. Oh yeah, clean the board and write this in for us. Example 7.3. We want to look at liquid formulation. Okay?
Yes, sir.
You remember I told you that 5 ml is nothing. 5 ml is what?
Nothing.
You have to specify what is inside that what 5 ml, because you can have up to 500 milligram in 5 ml, depending on the drug in question. So you saying 5 ml is ambiguous. Is what? Ambiguous. Use this one. Please, we've entered liquid formulation. Please listen carefully, please. Most people have issue here. Please. It's not that straightforward like solid where you just count them and This one you put. This one is concentration now. We have entered real solid liquid solution. So you need to really know how to calculate things that have to do with concentration before you can get this. Now look at the question here. It says a prescription requires a patient to receive a quantity of indigestion mixture with a dosage regimen of 15 ml 4 times a day for 5 days. How many 5 ml spoonfuls of the mixture will the patient require to take for each dose? Calculate the number of doses and the total volume that should be supplied to the patient. If you don't write out the regimen first, you'll be having issues trying to do calculation. So the first step is to write out the what? Regimen. They didn't tell us the name of the indigestion mixture, okay? They didn't tell us the name of the what? Indigestion mixture. So we can assume it, we can call it X or anything, okay? And the suspension, right? Is a mixture. Most of these in the indigestion mixtures are suspension. They come in suspension form. Most of them. Am I communicating? Yes. So you can adopt a dosage from suspension. Adopt the drug name X, since we don't know. And most of them, they are come as large volume. Or remember, in powder for bulk powder. So they don't come as bulk powder for internal use. Hope you know, which you now consume before taking, right? Those are if you watch, there's nothing like how many milligram it is. Not that the dose is not important, but it's not that a serious issue. That's why you're not seeing how many times in the meal. In this case now, just call it meals, okay? Let's work with meal and go away, okay? So here, you suspension. We adopted suspension, right? Suspension X. You say that that a patient requires a patient to receive a quantity of indigestion mixture with a dosage regimen of 15 ml 4 times. So 15 ml 4 times is what? QDS. A day for what? 5 days. With this, once you're able to achieve this, you are good to go. You've solved the question. You've solved the question already. So here we are told, we are now asked how many 5 ml spoonfuls of the mixture will the patient require to take for each dose. A dose is how many ml? From this regimen, a dose is how many ml? We are asked to calculate how many 5 ml spoonfuls will the patient take for each dose. So how many 5 ml spoonfuls for that one dose? 3 ml, 5 spoonfuls. Two of us. It's simple, right? 3, 5 spoonfuls. So the next question says, calculate the number of doses and the total volume that should be supplied to the patient. So now, for you to know what you should supply to the patient, you now put duration of treatment into what? Consideration. 3 of us. Yes. Because the patient will not take for 1 day and come back again. 3 of us. So if you want to give, you give what will last for 5 what? Days. It's not. So we ask how many doses, number of doses will the patient need for that 5 days. From here now, tell me, what the number of doses the patient need for 5 days? 20 doses. 20 what? Hey, Darasha. I need to write a textbook. Why they fail? Why they fail? A textbook. I'll write it. Why they fail? Where is their confidence? I said how many doses? Then why? You said it before. And I said, yeah. This is a dose, right? Yes. It's a dose, right? It's one dose. It's not one dose. It's not. One dose is 15 minutes. It's not. One dose times four. Four doses, right? Times five. 20 doses. Number of doses for this that should supply is 20 what? Doses. It's not. See your face. Is it confusing? Okay, we are. The question say that, listen carefully. This is regimen. 15 ml 4 times a day. So a dose is how many ml? So how many doses would the patient need a day? 50. How many doses? I'm not asking you about ml. How many doses a day? 4 doses. How many doses would you supply to the patient that will be enough for 5 days? Is it clear now? Is it clear? Please don't confuse. Don't get confused. Don't get stuck on doses. Dose and the male here. Even though they didn't specify the particular strength, but this male can serve as the quantity, as the amount, right? Right? Good. Please don't get confused. This male and dose are not the same. Even though one dose is 5 ml, one dose contains 5 ml. Are we together? Good. So the last person now say the total volume that should be supplied. So what the total volume? The answer is, what is now the total volume for the 5 days? Times what? 300, yes. 15 mil times 4, which is what? 60 times 5, which is what? 300. Is it clear now? Is it clear now? Is it clear now? Good. Huh? You want to write? Okay, I should write it. I've already taught you how to do it. Do it. I'm going to see what you did now. Do it. Precious. Okay, Chiku. Be warming up. You come and add this thing for us on the board. Please, fast. Let's go to another question. Let's see how far we can go before you get tired. Good. Right here. Right here. I'm not even stayed up to 2 hours here, sir. Huh? Question. Question. Ask. Feel free. Ask. Ask. Yeah, three. Good. I like that. So, here's a way. I have explained that before. If you want to write how many 5 meals, please don't write. Please, write it like this. Three what? 5 meal what? Didn't I explain this before? I don't write three, five what? It can be taken as what? 35. It's wrong, okay? Write it 3 5 meal spoonful. Please. What is it doing there? She's coming. I've left her. I've left her since she should come in and assist me. All right, look at this question. Let's look at this question. The question says a patient buys 100 ml antihistamine mixture. An example of antihistamine, you know. You say what? You say what? You say what? You say what? Example of antihistamines, bicarbonate. Hey, are you this? Give me the generic name, not brand name. Chloro what? Chloramphenicol. Chloro what? Chloramphenicol. Good. Another one. Good. Another one. Good. Another one. Azithromycin. Let's have this question. Okay, now look up. Look up. Hello. A patient buys 100 ml of antihistamine mixture to take on holiday. The dosage regimen is 2 5 ml spoonfuls 4 times a day. The patient asks if I take the mixture according to the instruction, how many days will the mixture last? Who can solve this question? I come and solve it. Koni aka. MCB 201 is waiting for you. So after this, I will attempt to random questions. Gift.
So what formula is connecting
Pound and what? Pound and weight to get what? You dey food you
Length and weight to get for this area because
you use nomogram.
for example, to understand this
Yes,
those
sir.
things.
You trace it. It's simple. It's simple. Eh? Yes, sir. Let's see what she did. Odekwala regimen. Who can write this regimen for us? Oh yeah, precious, come out fast. Image you go. Oh yeah, come out. Write the regimen for us. Write it well. You can write 10 me here. It's okay, no problem. You can write 10 me there. Good times here now. The antihistamine, we don't know it. Okay, you can leave that. No issue.
What is your next?
Yeah, but even anything you are writing, you need to tell us what X is. You know that X was not mentioned here. So if you write X, tell us, let the antihistamine be what? X. That the X mean is the anti what? Histamine. So know where X is coming from. Is it clear? You can use any symbol, but the main thing is to define what you are using. So we know you know what you are using, what it represents. So we don't know. Sorry, I'm wrong. We don't know the duration of the word treatment. So the question wants us to find the what duration of what treatment. So from here now, but all we know is that the mixture in the bottle is what 100 ml. So we want to know how long it will last, how many days. It's not just how long. How the specific, how many what days it will last. So since we know that it is what 100 ml. So let us now see. Since you know that it's 100 ml, this is the one that is presented, right? Yes. How it is what packaged, right? But let's check the dose, the total dose, total volume that will become total volume in a day. Okay? I am only total meal in a day. We now use it to divide this 100 to know how many days it will do what last. Okay? If you have 4 biscuits, and you are planning yourself that you eat 1 biscuit in a day, right? So a day is how many biscuits you eat? 1, right? You have 4 packets of biscuits, and you eat 1 packet in a day. So how many days will that 4 packet last for you? The same thing, because you divide that 4 packet of biscuit by that 1 you take in a day. You have 4 days, right? Bring that same thing here now. You have 100 ml packaged. Give it to the patient, but the patient will take 10 ml 4 times a day, which is how many ml? 40 ml. So how many ml will the patient take? This 100 ml will last for how many days? 100 ml divided by 40, 2.5, right? Which is 2.5 days. That's what she did. She first, during what she used, she opened up a book and then 2.5 people is what? I like this. 2.5 ml teaspoon is what? 10 ml. Then for a day, 4 ml, 40 ml for a day. So for number of days it will last is 100 ml divided by 40 ml, which is what? 2.5 ml. Half, 0.5 is half. So 2.5 days. Is it clear? Is it clear? And she wrote mail here. Please be careful, okay? It's not mail again, because mail will cancel mail. It's days, not mail. Okay, ask.
So I've seen where this kind of drug they prescribe it for
TDS.
like for 3, it will not last instead of for that 2.5, they now put this for 3 days. But it's only that 100 ml that is meant to last 2.5, but they say 3 days.
We are.
Like that place that she got 2.5. Can you be
Okay. What are you make it 3 days? 3 days? No. What? Hope you know that this thing, this is not like that one where you have to give more volume. Maybe let's assume that you are told that the person need to take it for 3 days. You can look for a way to add more bottles. True of us. But this one is that the one given is already 100 ml. So how many days will it last? You cannot appropriate it again. You be specific about how many days it will last. It will last for 2.5 days. Okay? Good. For 2, if let's assume the patient has 2 bottles, it should last for what? 5 days. Is it clear? So let me give some minutes for. Let me end this one. So get your questions for review. Let's look at it.